Hi, and welcome to Chapter 16, Emergency Response. In this chapter, we'll take a look at different emergency devices, so like the different types of trauma centers. There's a level 1, level 2, and level 3. You're going to take a look at equipment that you might find on the code cart. There are some medications that should be placed in the emergency cart that you need to be aware of. A lot of those types of things, when you get out to clinical, they will show you where those emergency carts can be found and what needs to be stocked in those carts. You also need to recognize the various oxygen administration devices that we've kind of talked about in the other chapters. So there shouldn't be anything that's very overwhelming or new in this chapter. So I do have a COVID restriction video that I want you to watch. So it's posted out there. So take a look at the emergency videos that I have posted for you. In the emergency department, there are different situations that can occur. You may have someone who comes in an ambulance, may have someone who's ambulatory and walks in. So the demands are going to be vary greatly from what that patient's needs are. You may have trauma units, so a level 1 trauma center that is going to have all levels of injuries, and they're staffed around the clock with physicians, and that may be the facility that you're working at. Or you could be working at a level 2 trauma center, which is a 24-hour emergency department, but they'll have less traumatic injuries that are coming to them because they'll get sent to level 1. Level 3s are your smaller hospitals. So these are in smaller communities. They're going to usually have an emergency department physician and a radiographer that may be on call. And they will deal with more of the, they fell off a bicycle or they were in an MVA, but they're not going to have the level of severity that you would see at a level 1 institution. So your emergency department is a special unit of the hospital that's equipped to deal with these traumas that come through and the emergency codes that are placed in that hospital. Some of these patients, again, will come in for minor illnesses, and so they're basically tying up time in the emergency department with things that could probably be seen at an urgent care office or through their family doctor. But they are coming to the emergency department because it's quicker and they get more of their meds or whatever they're looking for quicker in that situation. So you do see some, the book spells out your narcotics for recreation abuse that take place, but I think over the years they've gotten a little bit better with tracking these individuals that like to go from ER to ER and shop for narcotics. So again, there are the different levels. You got a level 1, level 2, and level 3. You have a trauma team that is staffed at each of these facilities to deal with emergency situations that come through. That team is pretty much going to be nurses that are trained in the trauma in the emergency department, anesthetists, respiratory therapists, ECG technicians, radiographers, pharmacists, phlebotomists. So you're going to have a whole team that's going in and taking care of this individual that comes through with a massive trauma. So your trauma patients may come in a backboard, they're going to be on a stretcher, they may have spinal injuries, and it's going to be up to you to take radiographs around that equipment and situation in that unit. So your role is to get into that emergency department. You may be bringing a portable in and taking that into the trauma room and trying to work around all of these people that are part of the team to get your radiographs. There are some emergency departments that have x-ray rooms, and so individuals that aren't an emergency that need that film right away to get them up to surgery, these individuals can go to your x-ray room and you can obtain your radiographs in that room. So anyone that's really a massive trauma is going to require the mobile equipment in the trauma bay, and we'll talk more about that role as we progress throughout the semester. There will be times where you have multiple patients in the emergency department at the same time, so you need to assess who's a priority. And don't be afraid to call the department and say, I need assistance. And there are going to be things that are going to be yelling for stat. This indicates that this needs to be done right away. So if it's a stat patient, that takes priority over someone else. So your highest priority is going to be given to those that are more unstable. They are going to be rushed up to surgery. They're waiting for that diagnosis so that they can get them out of that trauma bay. So you really need to take a look at, if it's a short exam, what can you get done and out of the way quickly, and move on to the more complex individual exams that need to be done. In a disaster response, these are things like tornadoes, earthquakes, floods, plane crash, train wreck, if it was a terrorist attack. These are going to be magnitudes of patients that are coming at the same time, and they typically will divide them amongst different hospital settings. But you could still end up with 50 people in the emergency department that all need immediate care. And so just be aware that that is something that could happen. Your hospitals will have a disaster plan put in place in case that happens. And every member of your healthcare team needs to know the plan and the drill and what needs to be taken place right away and what your role is in case there is a disaster response that takes place. When you are doing trauma, you need to really take a look at where are the patient's injuries. So try to go all of your APs at once, all of your laterals next, all of your obliques, so that you are running down the patient in limiting how many times you're going to be rolling them around. Make sure that you have protective equipment for your cassettes. So your digital plate should be put in that plastic. You have lead aprons, gloves, gowns, markers. That you're assisting the trauma team as much as possible. Make sure that you're introducing yourself and trying to get in to that patient and get out very quickly. Do provide radiation protection to any personnel that have to stay in the room, and don't be afraid to speak up and ask any of the nurses or physicians to help you get some of those positions put in place so that you can get out of there in a reasonable amount of time. The rule for radiographs, especially of the extremities, is going to be a 90-degree angle. So you want 2 radiographs at different angles so that they can determine if there's how much damage has been done in that area. Triage is an essential part of the disaster response. So this is defined as a process of identifying the victims and performing initial examinations, and then you're going to assign the priority for their future care. So a nurse will come through and they will triage the patient, and then they will set up what's going to be done with that patient. So generally they're going to be in a large central location. Your emergency call system, your facility's procedure to call for emergency help will be in place, so you need to make sure that you're aware of whatever codes are taking place for your facility. So usually they'll call a code red for a fire, code blue means that someone's heart has stopped, the amber code for an infant child abduction, so they're not going to change that from what it means in the public. So make sure that you're aware of what those codes are and what they mean. You're, again, part of the code team, so this is your designated group of healthcare workers who respond to that emergency code, so the radiographer will be called into that situation for an emergency. So when your code team gets there, make sure that you allow them to take over, and if you were the first person, let's say you're in the emergency department radiography room, you've done the patient, and then they code. Well, you're going to call in the code team, and you need to tell them, here's what I've done, and then stand by and follow any directions that they are yelling at you to do. Emergency carts, make sure you know where those crash carts are throughout the hospital, so that if you are in a situation where the patient does crash or code, you're able to grab that crash cart and bring it into the department. Some common equipment, again, we'll see a lot of patients with backboards. Make sure that you know where to find the items in your room. So you should know where your gloves are kept, where is a flashlight kept, so that if the power goes out, make sure you know where your defibrillator is kept in that department. So make sure you do a walkthrough when you are a student so that you are aware of where this items that you may encounter are located. You do have emergency cart medications. Typically, we don't stock the emergency carts. The emergency department nurses will take care of that as well. Patient assessment, again, you need to classify. Is it a non-urgent, urgent, or life-threatening? If it's life-threatening, they are top priority. So then we will go in. Trauma patients are going to be life-threatening, so they will be your top priority if they're ordered. We did that video before about the types of oxygen administration. Just be aware when the patient comes through the emergency department, they're going to be placed on oxygen in a life-threatening situation, as well as other lines. So they may have IV lines and they may have your EKG hooked up. And so you're going to be working around a lot of different lines. So make sure that you know where the oxygen tank line is so that you can work around it. You may have to do suctioning if you have them in your room and the patient is unable to clear their mouth or throat. So a device looks like this, and it literally has, right here you can see this plastic wand, kind of like what you see at the dentist office, and you just literally just kind of suction that out of their mouth. Or you can call the nurse and just ask the nurse to come in if you're in the patient's room doing a portable, and they can come in and help with that. So your suction checklist for that pump is to make sure that it's working correctly. You got tubing that's in place. And again, if you're not comfortable or know how to use it, make sure you contact the nurse, and one of the nurses or the patient care assistants will come down, so your CNAs, and they will help take care of that for you. So in a trauma situation, I do have a video that I want you to take a look at because it's kind of a fun video with some things that you might see coming through the emergency department. But know that when you're dealing with the trauma patient, you need to be aware of what type of injury and where is that injury taking place. Your basic rules: never move a trauma patient unless there's no other alternative, and never remove any bandages, splints, immobilization devices without permission from your physician. If movement is necessary, make sure that you ask for assistance. Your imaging of your trauma patient, again, try to get 2 different angles for that image. So your image is going to be an AP and a lateral, or it's going to be a PA and a lateral. We're going to make sure we radiograph those long bones so that we include both joints. And then if it doesn't, then you need to make sure that you get a separate image of both joints. Take a look at your patient when you go into the room and determine, do they have a spinal injury? If they have a spinal injury, then we have to do a lateral C-spine first, and then we can proceed from there with the rest of those spinal injuries. But we need to have them cleared so that we can move them on the board with the C-spine lateral first. Since your patient must not be moved, that lateral C-spine is always going to be your top priority, and once they're cleared, you may be able to get them off the backboard. Depends on what your doctor tells you can do. So these are some x-rays, images of your cervical spine and what it looks like. So this is what we're taking to them and asking for clearance from that procedure. Here's some that have a fracture. And so you can see right through here, if they do have a fracture, they're going to tell you to keep them on the backboard, and they will have that collar in place, and you can't remove the collar. They can have trauma with other areas of the spine, so there could be a fracture in the lumbar or the T-spine. So these are some examples of what those may look like. Look at this dislocation right here. So your extremities for your trauma: any break in the normal continuity of your bone. Your fractures could be restored to a normal position with or without surgery. So sometimes they will do where they're placing that bone back in place. So it's called a reduction. So a lot of times we'll see post-reduction films come to us that we're going to take an x-ray of so that we can determine, did they put that bone back in place where it should be. So these could be dislocations, or they could be fractures that simply could be reduced back into place. So here's some examples of some fractures that you're going to learn about. This again will take place, you'll hear me mention some of them, but mostly you'll learn about them in that pathology course and what they look like on the radiographs. We do have closed reduction fractures and open reduction. Closed reductions in the department where they are going to set it. Open reduction means that they're going to have to go up to surgery and have surgery done in order to place that back into place. It just depends on the severity of the fracture. If they do go up to OR with that open reduction, it is a sterile environment, and sometimes we run what's called the C-arm, and we will help guide them with their pins, screws, plates. So here you can see all of those types of devices on the radiographs. External fixators could be put in place for some severe injuries. So these are some examples of what those look like. And we do x-rays through this external fixation. So we'll put our imaging plate right underneath and take our x-rays through that. And so here's some examples of what that looks like. So no matter what method of reduction is taking place, we're probably going to have a pre and a post radiograph. Pre will help determine what the severity of that fracture and help the doctor determine what do I need to do. And that's why we have to have 90-degree angle films from one another, so that that helps them to determine what they're going to do. Is it going to be a closed reduction or an open reduction? Okay, so that is it for this chapter. Have a great rest of your week.